Paliperidone is an antipsychotic medication that can be taken through the mouth as a pill or also as an injection form. The injection form can be particularly important for those people who don't take their medications regularly. Also, the Invega injection is one of the easiest antipsychotic injectables to give. All one needs to do is take the oral form of Invega for one day, and if there's no side effects to it the following day, it's typically safe to administer the injection. Compare this to other antipsychotic injections where you may need to take the oral form for several weeks before you can administer the injection. Initially, when taking the injection, there are 2 injections given within the first week, and then you could give 1 injection every month after that. If you do that for several months, there is some options to even give a 3-month injection, so they can get the treatment once every 3 months. The injection is often given by a nurse in a hospital or clinic setting, but it can also be done through a pharmacy where the pharmacy is dispensing the medication. The doses for the oral medication is typically as low as 3 milligrams to as high as 12 milligrams a day. With the injection, the 1-month injection, it can be as low as 39 milligrams or as high as 234 milligrams at a time, depending on how high of a dose someone needs in order to have a clinical response. Also, to be cautious of someone with a history of kidney damage, in which they will need probably a smaller dose of the medication. This medication is particularly helpful in people suffering from schizophrenia, and oftentimes people with schizophrenia don't really see that they're sick or don't want to take medications. The injection can help treat their hallucinations, can help with the paranoia, can help decrease the chances that they'll need to be in a psychiatric hospital or that they'll need an emergency room visit. Paloperidone is also the active version of another medication called risperidone. I've talked about that in previous videos. Paliperidone can be a better choice, or the Invega is a better choice, in someone with a history of liver failure, because risperidone requires a well-functioning liver in order to make the active metabolite, which is the paliperidone. As with many other antipsychotic medications, this one can have similar side effects: weight gain, high cholesterol, high blood sugars. Blood monitoring should be done regularly. It can block the dopamine receptors in parts of the brain that help with hallucinations, but also can block dopamine receptors in the parts of the brain that deal with movement, so people can get shaking, tremors, Parkinson's-like features. It can also increase the electrical activity of the heart, the electrical rhythm of the heart, so it can increase one's ability to have a sudden heart attack also from these medications. But if you're looking for a choice of an injection that someone can take once a month or once every 3 months, Invega could be a good choice. It's typically easier administered than some of the other long-acting side effects, and it's indicated for schizophrenia and schizoaffective disorder.